and foremost, I'd just like to congratulate all of you guys who put in a lot of effort to be here with us and to look at the case studies. I'm not going to be speaking as a Zambian national, but I am definitely very proud that the Zambian team has risen to the occasion and put forward their best foot forward, Professor Chilenga and team. And let's look at Zambia as a case study. And let's prove ourselves. We do have now time to come back with tangibles by the time that we're meeting in November. I think it's 27th to the 30th of November, to see what we have been able to achieve until then. All right. Secondly, from a supply chain side, as a member of ARC, clearly supply chain is one of the most difficult areas that we are facing on the continent. But I think working smarter, better, together, we can achieve more. And I look forward to working with all of you to achieve those three things: smarter, better, together. And for the kids on the continent, and remember, Africa is the oldest continent with the youngest population. If we do not sort out that problem right now, it's going to be a disaster for all of us. Thank you.
With that said, I just want to thank you all. This has been a truly exceptional session and really paves the way shortly as I actually jump on the plane and join you not too long from now. And really, I think the idea of following up perhaps in those trusted circles with the extraordinary cases that were identified, but also recognizing, and I think we all drink, and many of you have created and stir the Kool-Aid, is doing business not as usual. Recognizing that as we opened up, coming from the spring meetings with IMF, World Bank, where we're dealing with tight fiscal spaces. And so how do we create those innovative models where there could be perhaps even some restructuring? We know Zambia has been mentioned several times. They also were leaders at those spring meetings around how they were restructuring debt so that some of that could go towards actually human resources for health. But then enabling policies that we know on the ground that could be exceptionally helpful in the last mile in terms of how we look at alternative supply chain, not just from public medical stores, but from private sector. And with that said, I think I'll end with the magnificent comment that one of the colleagues just shared earlier was the magic, as we know, is not anyone wearing a tie or a suit from the Beltway or other places. It's really the frontline sheroes delivering the services and also the voices of the clients. And I'll say that very briefly that I had just gone through a series of site visits through different countries that we operate in sub-Saharan Africa and saw such extraordinary impacts and transformation using fintech around leveraging national health insurance and private insurance. And I think that we can all feel very optimistic about what comes next, especially as we ideate together in these smaller groups with the cases and seeing where we could scale for impact. And with that said, thank you so much. This has just been a really fantastic and wonderful session to join in.